Okay, let's talk about something huge that affects so many of us, sometimes quietly, sometimes devastatingly, heart disease. But what if I told you there's this really deep, impactful link to obesity? It's maybe stronger than we realized. I mean, cardiovascular disease globally, the scale is massive. And here in India, it's particularly staggering. We're talking 71.13 million CVD cases back in 2019. Plus, India has the third largest population with obesity in the world. You put those two together, you really start to see this critical connection taking shape. So our mission today in this deep dive, we want to explore some really groundbreaking new research. It's looking at how managing obesity effectively might actually be a key way to improve heart health, maybe even, mending broken hearts in a real measurable way.
Yeah, it's becoming clearer and clearer. We really need to shift how we think about obesity. It's not just a lifestyle thing. It's increasingly seen as a chronic, relapsing, progressive disease. And it acts like a gateway, really, to a whole range of other non-communicable diseases. So that connection between weight and cardiovascular health, it's direct and sometimes surprising, even for people we might have previously thought were quote-unquote metabolically healthy.
Okay, so let's dive into those numbers, especially the ones from India. They sound pretty alarming. What exactly are we looking at?
Well, they really do paint a stark picture.
Yeah.
If you look back at 2016, cardiovascular diseases were responsible for, get this, 28.1% of all deaths in India and 14.1% of total disability-adjusted life years.
Dailies.
Dailies, just remind us.
Right. So dailies, for you listening, that's basically the total healthy years of life lost because of illness, disability, or dying too early. It's a really sobering way to measure the burden.
Wow. And then look at the ICMR Indiabi study projections from 2021. They estimated 254 million adults with generalized obesity, and even higher, 351 million with abdominal obesity. That's the dangerous fat around the middle. These aren't just abstract numbers. That's millions and millions of lives affected.
And here's something really concerning I read. Even though overall heart disease deaths have sort of decreased a bit between 99 and 2020, deaths specifically linked to being overweight or obese, they've shot up. Threefold increase in that same time.
Exactly.
And something like 70% of deaths related to overweight or obesity are actually because of cardiovascular disease.
That really changes the focus, doesn't it?
It absolutely does. It highlights where a huge part of the problem lies and maybe where the solutions need to focus too.
And it makes you question that whole idea of being metabolically healthy but still having obesity. Because the data shows even those individuals who might look okay on some tests, they still face a much higher CVD risk, like 38% higher. That's right. And a 65% increased risk of heart failure compared to people with normal weight who are metabolically healthy.
65%.
Yeah. And then if you look at people with obesity who are not metabolically healthy, their CVD risk is basically double.
So that idea of healthy obesity might actually be, well, pretty dangerous, like giving a false sense of security.
I think that's a fair assessment. It underscores that even without obvious signs like high blood sugar, the extra weight itself is putting a definite strain on the heart and vessels. The risk is building over time.
That really drives home the urgency. But thinking back, getting people to lose weight and keep it off has always been tough. And finding medications that actually help with weight and reduce heart risk, that's been even harder, hasn't it?
Oh, absolutely. Historically, achieving sustained weight loss is incredibly difficult. That's just the reality. And this is key. Most traditional weight loss strategies, diets, exercise plans, they haven't consistently shown they reduce cardiovascular risk.
Right.
The big exception, really, has been bariatric surgery. That has shown more consistent benefits for the heart.
And the drug side of things, pharmacotherapy. That's had a rocky past too, right? I remember reading about trials like Scout, Crescendo.
Yeah, exactly. Light, Convene, Camellia Timi, several of those big trials. Unfortunately, they either showed an increased cardiovascular risk or they had to be stopped early for various reasons, or the drugs even got withdrawn later.
So yeah, pretty tough track record. It sounds like a path littered with, well, good intentions but setbacks. Must have been some caution when this new research started.
You're absolutely right about the past challenges. And yes, there was definitely a healthy dose of caution, maybe even skepticism in the field. But also, I think, immense hope that maybe, just maybe, this time would be different. And thankfully, the latest research really seems to be delivering on that hope.
Okay, so after all those challenges, it really does feel like we might be turning a corner. Which brings us neatly to the SELECT trial. This sounds like a really big deal. Why is it so important, and what did it involve?
Oh, SELECT was absolutely monumental. It's one of the largest cardiovascular outcome trials ever done. We're talking 17,604 participants. Huge number. From over 40 countries, actually, including nearly 500 people right here in India, 492 to be exact.
Wow.
And they followed them for a good while. Median follow-up was 40 months, so a decent long-term view. The design was super rigorous, double-blind, placebo-controlled superiority trial. And the focus, it was on people aged 45 or older who had overweight or obesity, so a BMI of 27 or more. And crucially, they already had established cardiovascular disease.
Okay, established CVD.
Yes, but, and this is important, they did not have a prior history of diabetes.
That was
The key exclusion.
Got it. No diabetes. And what were they primarily looking for? The main outcome.
The primary endpoint was a standard composite, MIS-C, major adverse cardiovascular events. Specifically, they looked at the combination of cardiovascular death, non-fatal heart attack, myocardial infarction, or non-fatal stroke.
Right, the standard MAC3. And the big headline finding.
The headline is that Wegovy 2.4 milligrams, that's the drug semaglutide.
Right, semaglutide, that's a GLP-1 RA.
Exactly, a GLP-1 receptor agonist. It basically mimics a gut hormone involved in appetite, blood sugar, and apparently cardiovascular function too. Well, Wegovy is the first anti-obesity medication ever to show a proven reduction in MACE in this specific group of patients, those with established CVD but without diabetes.
The first one. That is significant. And the reduction itself.
A significant 20% reduction in the risk of MAC compared to the placebo group.
20%, okay. And I saw a figure about absolute risk reduction, 1.5%. How do we understand that number for, an actual patient?
That's a great question. So an absolute risk reduction of 1.5% means this. If you treated 100 people with Wegovy instead of placebo for the duration of the trial, about 1.5 fewer people would experience one of those major events, a CV death, heart attack, or stroke.
Okay.
Now, 1.5 might sound small, but when you scale that up across millions of people who fit this profile, you're talking about preventing thousands upon thousands of really serious events. It's a very real benefit for individuals.
Right, that makes sense. It adds up significantly. But here's the part I found fascinating. You mentioned this nuance. The risk reduction, the benefit, started showing up early, before people had even lost the maximum amount of weight.
Exactly. That's one of the most striking findings. The MEC curve started separating pretty early on. But maximum weight loss with Wegovy in the trial didn't really happen until around month 14.
So if it's not just the weight loss causing the heart benefit, or at least not all of it, what else is going on? That's the big question, isn't it?
That is the big question, and maybe the biggest revelation from SELECT. The analysis suggests that roughly 80% of that ME risk reduction seems to be driven by factors other than just the loss of body weight.
80%? Wow.
Yeah. And the benefit appeared to be independent of how much weight people actually lost. So this really forces us to think differently. We're not just looking at a weight loss drug here. This suggests semaglutide might have direct beneficial effects on the cardiovascular system itself. Maybe reducing inflammation, improving how blood vessels work, affecting metabolism in ways we're still figuring out. It opens up a lot of avenues.
That's genuinely groundbreaking stuff. And were there other benefits besides that main ME endpoint?
Oh, yes, absolutely. The positive effects were pretty consistent across the board. They saw a 19% reduction in the risk of death from any cause, all-cause mortality.
Okay, that's important.
And an 18% reduction in the risk of composite heart failure outcomes. That's things like being hospitalized for heart failure, needing an urgent visit, or cardiovascular death related to heart failure. There was also a 15% reduction specifically in cardiovascular death. Now, statistically, that particular one just missed the mark for significance on its own. But it certainly points towards a benefit, especially when you see it alongside all the other positive results. It fits the overall picture.
So zooming out, these findings are clearly having a ripple effect, even changing medical guidelines already.
Precisely. It's happened quite fast, actually. The 2024 European Society of Cardiology, the ESC, their guidelines on chronic coronary syndromes. They now specifically recommend semaglutide for patients who have overweight or obesity and chronic coronary syndrome, but without diabetes, precisely to reduce the risk of CV death, heart attack, or stroke, based directly on SELECT.
Wow, that's quick adoption.
It is. And here in India, too, the CDSCO, the Central Drug Standard Control Organization, they've also updated the official label for Wegovy 2.4 milligrams to include this cardiovascular benefit information. It really marks a significant shift in how we can treat these patients.
Okay, so huge news for heart health. But you mentioned it seems to be doing things beyond just weight loss for the heart. That makes me wonder, what about other parts of the body, like body composition? liver health, other metabolic stuff. Let's maybe shift gears slightly. For someone listening who might be wondering if this therapy is for them, who is a suitable candidate, and what are the practical things, patients need to consider?
Right, good questions. So Wegovy 2.4 milligram, it's indicated as an adjunct to a reduced calorie diet and increased physical activity. Lifestyle changes are still fundamental.
Always key.
Absolutely. And it's for adults with an initial BMI of 27 or more that's technically overweight, who also have at least one weight-related health issue like high blood pressure, high cholesterol, sleep apnea, things like that. Or it's for adults with a BMI of 30 or higher, classified as obesity, and in that case, you don't necessarily need another specific comorbidity listed.
Okay, 27 plus with a comorbidity, or 30 plus regardless.
Exactly. And there are also specific Indian weight management guidelines, which are slightly different. They recommend considering pharmacotherapy alongside lifestyle changes for Asian Indians with a BMI over 27, or even if their BMI is just over 25, if they already have one of those related conditions like hypertension, type 2 diabetes, dyslipidemia, or obstructive sleep apnea.
Okay, slightly lower threshold potentially for Indian populations with comorbidities. That
Yeah.
sense. And practically, how is it taken? Dose, side effects.
So it's a once-weekly injection. You start at a low dose and gradually increase it every 4 weeks. This is called titration. The goal is to reach the maintenance dose of 2.4 milligrams per week. That gradual increase is really important because it helps manage potential side effects, especially the gastrointestinal ones.
Ah, like nausea. I hear that's common.
Nausea is definitely the most common one, yes. But the titration helps, and there are tips for managing it. Eating smaller meals, maybe more frequently, stopping eating when you feel full, not pushing it, and maybe cutting back on really fatty, fried, or super spicy foods can help some people.
Good practical tips. Anything else people should know before starting? Cautions.
Well, like any medication, there are considerations. It should be used with caution in people with kidney or liver problems. Also, anyone with a history of acute pancreatitis needs careful consideration. And it's a definite no-go during pregnancy or breastfeeding. In fact, women planning a pregnancy should stop taking it at least 2 months beforehand.
Right, important safety points. Okay, back to the beyond the scale idea. Body composition, you mentioned visceral fat earlier. What did the study show there?
Yeah, this is really interesting. Beyond just the total weight loss, Wegovy seems to improve the quality of the weight loss. Studies showed it led to a favorable ratio of fat mass loss versus lean mass loss. So you lose more fat than muscle, which is good. Significant reductions in total fat mass average about 9.2 kilograms. And yes, some lean body mass loss too, around 5.4 kilograms, which is expected with weight loss.
Okay.
But crucially, there was a notable reduction in that abdominal visceral fat area, the VFA. That's the really dangerous internal fat wrapped around organs. Some estimates showed reductions as high as 34.42%.
Wow, over a third reduction in visceral fat. That seems huge for health.
It really is. Targeting that specific type of fat is thought to be incredibly important for reducing long-term risks of things like heart disease and diabetes. It suggests a deeper metabolic improvement.
Okay, compelling trial data. But the million-dollar question, does this hold up in the real world, outside the controlled environment of a clinical trial? Is there real-world evidence?
Yes, the real-world evidence question. It's critical, and the answer seems to be yes. There's the SCORE study. This was a retrospective look back at actual patient data observational real-world evidence. They looked at semaglutide 2.4 milligrams used in routine clinical practice in a group very similar to the SELECT trial. People with overweight or obesity, existing atherosclerotic cardiovascular disease, but no type 2 diabetes.
Okay, so basically mirroring SELECT, but in the real world.
Yeah.
And the results.
The results were actually quite striking. They found a 57% lower relative risk for what they called revised ARE3 that included heart attack, stroke, and all-cause mortality.
57% lower, compared to the 20% in SELECT.
Yeah, quite a bit lower risk seen here. And for the standard ME3, MI, stroke, and CV-related mortality, the risk was 42% lower. Even more dramatic, all-cause mortality risk was 86% lower, and CV-related mortality risk was 73% lower in this real-world cohort compared to matched controls not on the drug.
86% lower all-cause death, 73% lower CV death. Those numbers are incredible. Almost hard to believe.
They are very impressive. Now, it's observational data, so we need to be a bit cautious with direct comparisons and causality.
Sure, correlation, not causation necessarily.
Exactly. But the conclusion from the SCORE authors was pretty strong. It suggests that the real-world populations, similar to SELECT, might actually do even better on this therapy than what was reported in the SELECT trial itself.
That's a powerful suggestion, really reinforces the potential impact. Okay, so heart benefits look solid, maybe even stronger in the real world. Body composition improving. Right. What about other organs? You mentioned liver health earlier. MAH.
Yes, MSH, metabolic dysfunction-associated steatohepatitis. That's basically fatty liver disease that's progressed to include inflammation and liver cell damage. It can lead to cirrhosis and liver failure.
And treatment options have been limited, right?
Very limited.
Yeah.
So the Essence trial results were really welcomed. It showed that Wegovy 2.4 milligram is actually the first and only GLP-1 RA treatment to demonstrate clear benefits for patients who have MASH and moderate to advanced liver fibrosis stage 2 or 3 fibrosis.
First and only. Okay, what did it show?
The interim results were really positive. Almost 63%, 62.9% of patients on semaglutide achieved MASH resolution, meaning the inflammation and damage got better without their fibrosis getting worse. Compare that to only about 34%, 34.3% in the placebo group.
Big difference.
Huge difference. And nearly 37%, 36.8%, actually had an improvement in their liver fibrosis stage without their MASH getting worse, compared to just 22%, 22.4% on placebo. Plus, they saw improvements in non-invasive markers like blood tests that indicate liver fibrosis and MAH activity, and liver enzyme levels improved too.
So real histological and biomarker improvements for the liver. That's another major area.
Absolutely. A potential game changer for managing progressive liver disease linked to metabolism.
Okay, another tough area. Heart failure. Specifically HFpEF heart failure with preserved ejection fraction. That's notoriously difficult to treat effectively. Any news there?
Yes, another area where options are needed. There's compelling data emerging here, too. If you pool the data from several key trials, STEP-HFpEF, STEP-HFpE-FDM, and also relevant data from SELECT and FLOW, you see a consistent picture. There's a reduced risk of the composite outcome of either CV death or a first worsening heart failure event. The hazard ratio was 0.69.
Meaning out of the 31% risk reduction for that combined outcome.
Precisely. And if you look just at the risk of a first worsening heart failure event on its own, the hazard ratio was 0.59.
So roughly a 41% reduction in risk for worsening HF.
That's right. And this benefit seemed consistent across different patient subgroups, although it perhaps looked even more pronounced in those with a higher BMI, say 35 or above.
Okay.
So this combined evidence is really the strongest we have to date, suggesting semaglutide can be an effective therapy to reduce clinical heart failure events, specifically in people with HFpEF. And as you said, they currently have very few proven treatment options.
So heart, liver, heart failure. It really is reaching beyond just weight. Let's wrap up this section on benefits. What about just the general cardiometabolic picture? Blood pressure, cholesterol, blood sugar control, the things that often go along with obesity.
Yeah, the broader cardiometabolic benefits are definitely part of the beyond the scale story. Trials like STEP 1, which looked at longer-term use, showed really persistent improvements. Significant reductions in waist circumference, average loss of over 15 centimeters. That's substantial.
That's inches off the waistline. Very tangible.
Exactly. Also, drops in blood pressure, systolic down by about 7 points, diastolic down by 3 points. Improvements in lipids too, LDL cholesterol down slightly, triglycerides down significantly, around 22%, and hsCRP, that marker of inflammation we talked about, down by nearly 40%, 39.1%.
That inflammation marker drop seems really key for overall health.
It really does. Chronic inflammation is tied to so many long-term problems. Seeing that come down suggests a fundamental health improvement, and maybe one of the most promising findings, blood sugar control. In the STEP 1 trial, among participants who started with prediabetes, more than half of those on Wegovy, 84%, actually reverted to normal blood sugar levels by week 104.
84% reversed prediabetes compared to placebo.
Compared to only 48% in the placebo group. So a huge difference in progressing towards, or rather away from, type 2 diabetes.
That truly underlines it, doesn't it? Improvements in health really have to go beyond just the number on the scale.
Absolutely. It paints a much more holistic picture of metabolic health improvement.
Okay, let's try and bring all these threads together. Imagine a patient, let's call her Sarita. Say she's 40. Her BMI is 34, so she fits the criteria. She's got a family history of heart disease, maybe she has prediabetes herself, some fatty liver showing up on scans, high cholesterol, maybe even early signs of that HFpEF we discussed. She's tried lifestyle changes, maybe a couple of times, hasn't really worked long-term for her. She wants to be more active, live healthier. How does all this new evidence we've just walked through, how could it apply to helping someone like Sarita? Managing her overall health, not just laser focusing on her weight number?
That's a perfect way to synthesize it. For someone like Sarita, with that cluster of risk factors and conditions, This new evidence is incredibly relevant. We're not just talking about helping her lose weight, although that's part of it and likely beneficial in itself. We're talking about a therapy that has now shown, through rigorous trials like SELECT, direct cardiovascular protection, potentially reducing her risk of a future heart attack or stroke, independent of just weight loss. We're seeing potential benefits for her liver health, possibly slowing or even reversing the progression of her fatty liver disease, the MSH. There's evidence it could help with her heart failure with preserved ejection fraction symptoms and risk. It's likely to improve her blood pressure, her cholesterol levels, and significantly increase her chances of reversing that prediabetes, preventing progression to full-blown type 2 diabetes. So for Sarita, it's about moving beyond just weight management to true health management. It's about tackling multiple interconnected problems with potentially one therapeutic approach, alongside lifestyle, of course. It offers a pathway to improving not just her numbers, but her actual quality of life and her long-term health trajectory across several different domains. It's genuinely holistic in its potential impact.
That really connects all the dots powerfully. And that brings us toward the end of this deep dive. It's been fascinating. We started by looking at the really profound impact of obesity on heart health, those stark numbers, especially here in India, and challenging that idea of metabolically healthy obesity. Then we moved into the SELECT trial, a true breakthrough, showing that significant MAC reduction with Wegovy 2.4 milligrams. That's really changing the game in cardiovascular medicine. And crucially, we explored how the benefits ripple outwards, going far beyond weight loss into areas like liver health with MHH, heart failure like HFpEF, and just broad improvements in cardiometabolic health markers.
It's been a remarkable journey in research recently, and it leaves us with a pretty big thought, doesn't it? If we accept that obesity is this gateway, this root cause leading to so many other major chronic, non-communicable diseases, what happens if we start truly treating obesity itself as the chronic disease it is? What new frontiers could we unlock? If we effectively integrate these kinds of multifaceted therapies, the ones that tackle weight but also offer these broader cardiometabolic benefits, into standard care, how could that shift, that fundamental change in approach, completely redefine what well-being and long-term health look like for literally millions of people around the world? It's something to really consider.